can go whoever's next. You just come right up here. Yeah. Just have a seat right there. Hi. Good morning. How are you? Okay. Well, it's completely normal to be nervous before any type of procedure, whether it's big or small. But I'm glad to hear that you're feeling okay otherwise. Right now, you get to relax. You don't have to worry about any pre-op things happening. No needles, no anesthesia, not yet. I'm just going to be checking you in for surgery, and then after that's done, a nurse will come and collect you, and anyone you've brought with you to take you back and get you ready for your procedure. So does that sound okay to you? Perfect. So I'm just going to ask for some information. Can you just give me your name so I can confirm it with the system? Okay. And what's your social? Perfect. Perfect. And can you go ahead and give me your date of birth? Perfect. Okay. Alright, and do we just have to confirm? We already have you here in the system, but what are you having done today? What's the procedure? Okay. Okay. And I'm assuming the surgeon kind of went over exactly what to expect with that. Right. Yes. Yes. Yeah, that's sort of to be expected afterwards. And I'll be printing some things to give you. You'll collect them after surgery. I'll give them to them so they can have them for you. But that's sort of a normal side effect afterwards. But if it gets any worse than that, then of course give us a call. And how long has this been going on? Like how long before they decided that you needed to have the procedure? Wow, bless your heart. I couldn't imagine putting up with that. Years of that, I couldn't do it. Well, hopefully this procedure can give you some relief. So, and can you go ahead and confirm you know what today is? The date? Perfect. Okay. Now, I'm just going to go ahead and ask you. We have to ask everybody these questions. I know they're sort of invasive, so of course. If you need just a moment to just take a breath, I'll take a breath with you, because I understand how nerve-wracking it can be, so. Don't you apologize. Trust me, I've had people pass out on me in here, and it is not a big deal. This is just the way it goes, you know. But I can assure you, our doctors are very professional, very well trained, and I wouldn't trust anyone else with my own family. So let me go ahead and ask you some of these the health status and your history questions. Do you have any known allergies? Any medication allergies? Okay. That shouldn't come into play today. Okay. And no other allergies that you know of? You've never had any reaction to medications? Okay. Perfect. When was your, well, have you been hospitalized in the last 3 months? Okay. Seen a provider outside of our surgeons in the last 2 weeks? Okay. So you were referred. Okay, yes, you were referred a month ago. Right. That's perfect. Okay. Been outside of the country in the past year? Okay, perfect. And are you updated on all your vaccinations, your COVID vaccine, your flu vaccine? Okay, and do you have a list of any current medications you might be taking? Perfect, that's my favorite thing to hear as a receptionist. Let me have the medications. So it's this one, okay, and this one. Perfect. Okay. So it's easier for me to spell because I can't even pronounce them, let alone spell them, you know what I mean? It gets kind of ridiculous. When you know I still spelled it wrong. Okay, and you take this one. Perfect, once in the morning, perfect. Okay, you can have that one back. And this one is as needed, right? Okay, it says take once daily, but okay, so as needed. For your anxiety. Perfect. I totally get that. There we go. Okay. And now, before you go in for your procedure today, have you had any past procedures? Anything as small as wisdom teeth removal? Okay. Perfect. And when was that one done? Let me do the math in my head. Perfect. Okay, and do you have any pre-existing conditions? Okay. Do you want me to add that into your chart? Because it's not in your chart. Absolutely, I can. That's no problem at all. Okay. Now, I'm sure you've already met with our anesthesiologist, or they spoke to you on the phone, or... Right. Okay, so you did speak to them about your anxiety medication. Perfect. Okay, and did you take your medication that was the daily? They gave you okay, perfect. Okay. And besides just a sip of water, have you had anything to eat or drink in the past 12 hours? No. Perfect. Otherwise, we'd have to send you on home, and I hate to do that, but that's, some people think I can guzzle the water and it doesn't affect me because it's not the food. But it's eating or drinking. It's just for the anesthesia process. Perfect. And do you have an advance directive filed with the hospital? Okay, perfect. And if you want more information about that, you can contact our services downstairs. So what, if any, I'm assuming our surgeons ran some tests on you, but what were, have you had any preoperative tests performed? CTs, blood work? It should be on our system, but I just want to note it in your chart. Okay, so you had panels a week ago. Okay, perfect. We should be able to pull those, just so we know we have them on file. Okay, and a scan. Perfect. Contrast or no contrast? We can look it up if you don't. Okay. Perfect. I hate the taste of it too. It makes you want to pee and it's nasty. Perfect. of your insurance card and your ID, just so I can put it to the system. Perfect. Thank you so much. Okay, let's see. Okay, and then okay. So we make the numbers on these smaller and smaller every day, don't they? Perfect. Okay, I'll just slide these back to you. And is there anyone, emergency contacts that you would want to have listed besides the people you've brought with you today? Perfect. Perfect. Yeah, it's hard having to come and be alone. I feel a lot of empathy for the people who come, and it's clear it's more of an obligation, you know. So I'm glad you have people that are surrounding you with love, and because they're gonna be right out here. They'll actually be out here with me until you get closer to moving towards post-op, and then one of us would escort them over to the post-op waiting room. Perfect. Okie dokie. And that number you said was the same as yours. Perfect, perfect. Okay. And let me just double check that I have everything for you before I get you on your merry way and get you checked in. Let me have your address again. I didn't confirm that. I'm sorry, hon. Okay. Perfect. And your phone number is still perfect. Great. Well, I think that does everything on my side. I'm just going to need you to take this pad here, and I'm going to need you to digitally sign. So if you could do that for me, that would be great. Okay, perfect. And that was just for consent for the procedure today. And then this one's going to be for your anesthesia consent. So perfect, perfect. And then this one is going to be for your information about the hospital's healthcare and post-op follow-up. Just to say that I'm going to be giving you some papers you can take with you. That can give you more information if you need it. So just sign here. Perfect. Alright. Well, I think that about does it for me. The time is perfect. Alright then. Well, listen, everything is going to go smoothly. You know, have that positive attitude, have class full is what I always say. Don't forget your ID and your insurance and your medications. And just run you down. You don't have any lotion on, you don't have any perfume, no deodorant. Perfect. No, these come out. Perfect. Perfect. show me nail for the postal. Perfect. Great. So you're down. You got it. Well, if you need me, before they bring you back, I'm right here. All of our nurses, all of our staff are fully equipped to help you with anything you need. Don't hesitate to ask any questions. And yeah, so good luck. We will all see you on the other side. So you can just go have your seat back there, and they'll call you when they're ready. Yeah. Okay, I can get whoever's next.